the physiotherapist from Quebec. Bonsoir, mesdames et messieurs. Je suis excité pour l'événement de ce soir. Je m'appelle Karim Megji, and I am the private practice chair and of the CPA. I am so excited to help represent you guys. I realize how tiresome you guys are. I realize how hard and how sore your hands are from the manual therapy, how sensitized your hands are from the copious amounts of hand sanitizer. I know how tired your mind is of all of the COVID restrictions, the precautions. When will this end? I know how tethered your soul is for the lockdown that was and the lockdown that could be. But tonight we're going to make history. Tonight, we are going to change the narrative. Tonight, we bring the province's executive leadership from coast to coast to unify the nation, to unify a message to conquer COVID-19 and tell it today, not tomorrow, not ever, because as a profession, we are collaborating, we will conquer. I'm so excited to make history tonight. Who's ready in the chat to get this started right now? All right, guys, Jesse, that's amazing. Here we go, guys. I'm going to go from the West Coast. Let's go. On the West Coast, I love to introduce the CEO, Christine Bradshaw. Christine, where are you coming from right now?
West Vancouver.
West Vancouver. What is the one word that describes what you're feeling like right now from West Vancouver?
Focused.
You're focused. Now, Christine, I'm gonna talk to you first before we get to the other panels. Give us a brief rundown. What's going on in BC right now? Just give us a general rundown.
Well, so in British Columbia, lately we've had over 600 cases a day, and yesterday it was just over 700. So about 2 weeks ago, our provincial health officer added another order, especially for Fraser Health and Vancouver Coastal Health, our two largest populated regions, for them to have non-essential travel, to stay home if possible, and to keep groupings to your household. So we can see that there's a bit of a pullback there from what we had been doing over the summer. We expect a significant update tomorrow from the Minister of Health and from the Provincial Health Officer. Right now, physiotherapy clinics are open, and they're working diligently following infection control practices and modeling that leadership behavior that works so well in keeping them open. We do know that there is a lot of virtual health happening, and I am often in meetings with the provincial health authorities, some of the physios that work there, and they're actually doing about 50% in most of the health authorities, about 50% virtual health. So
fantastic. That's amazing. We're going to go to the center of Canada, and we're going to the Manitoba, the executive director of the Manitoba Physiotherapy Association, the man with the Golden Gate Bridge behind him, Jim Hayes. Give us an update, man. How are you feeling right now? Give me the one word that describes what you're feeling.
You know what? I got a lot of time for Christine. I think we think alike a fair bit, and I had written down the one word was focused. But if you want a second one in addition to that, I would say it's determined.
Fantastic. So, Jim, take me, I've heard a lot of rumors about Code Red in Manitoba, about ice rinks being used as hospitals. Tell me what's going on down there.
You know, it's interesting. As of Thursday, November 12th, the province moved to the critical level of Code Red, and we're doing everything as a province that we can to get through this at this juncture, and it's to ensure that our most vulnerable Manitobans survive and ensure that our health system is not overloaded. And it's going to be, as the Premier has said, the proverbial team effort in terms of, and it takes individual responsibility and a sense of community. And so with that, the following are in place. Social contacts reduced to your household only. Social gatherings not permitted. Travel to and from northern Manitoba restricted. Retail businesses, including grocery stores and pharmacies and so on, open at 25% capacity. Retail business, e-service, curbside, and delivery. Personal services, including hair salons, barbers, all that kind of thing, pedicures, manicures, and so on, closed. Gyms, fitness centers, closed. Religious and cultural gatherings, virtually only. Restaurants, pickup or delivery. Recreational activities, sports facilities, casinos, museums, galleries, libraries, movie theaters, concert halls, closed. And so we've just moved to this, and it's going to be for a 4-week period, and we hope to bend this curve, particularly during weeks 3 and 4. It'll take a couple of weeks just to work through this. One person only from the family to go to shop, that kind of thing. And so we have gradually stepped up to this level, but it crested, and we've been averaging about 400 new cases a day. Our positivity rate is at 14 today, is at 14.2. In Winnipeg, it's 13.8, 400 more new cases. And so we're in a challenging situation right now here in Manitoba, but I sense that we're going to get through it. And there are some interesting dimensions. There was one town that in southern Manitoba that there was a bit of a gathering to say that people don't like wearing masks, and it's to just keep your balance and to see that we are gracious, but by the same token, purposeful and clear. And I can tell you that there's fines now for being in public without a mask. There's all that kind of thing going on, but it's not just to be punitive. It's just to see that there's compliance. But because we're such a pluralistic and yet connected society, we're determined, I would say, to see that we are mindful for each other. But there's no question that there's a real focus to get this really changed in the next 4 weeks, and then we can go better from there.
Jim, you know what? You are a phenomenal storyteller. I just got lost in your narrative, and I just wanted to confirm that you said physiotherapy is still open. Is that correct?
Yes, it is. And later on in it, I'll share what I believe are the essentials that are making that happen, and how it started, and how we're looking to be resilient in getting through on the other side. And it's a credit to the physiotherapists in this province.
That's fantastic. I don't want to spoil the whole show, because did you ever think that Manitoba was going to set the narrative for the entire nation, where health metrics, so hospital utilization, ICU capacity, case numbers are tipping the scale? This is not theoretical. This is the real deal. When Manitoba has tipped the scales and is going into that full lockdown. Would you ever thought Manitoba would be writing the narrative? What do you think, Jim?
Well, two things. One, it's to have an abiding sense of absolute humility and to keep learning from each other. That's fundamental to that. If you stop doing that, you're in trouble. And then number two, though, is to recognize what we have to work with. And we do have some advantages in terms of our size and the way we're put together. And we're looking to really utilize those strengths. It's much like a sports narrative where you size it up and then you go after it.
Yeah, absolutely. That's awesome. Now we're going to go over to Ontario, the PGM, right? The president of the OPA, Paulette Gardner-Miller. We've had lots of conversations, Paulette. I'm so excited, so jacked up to hear about Ontario.
I feel like I'm about to go into like a wrestling match or something with that kind of an intro. So hi everybody, nice to be virtually in a meeting with you guys, and it's exciting. We got people from all over the country, so thanks for coming. So Ontario, similar to other areas, our numbers are definitely going up. Our government has put together a response framework. I'll put the link in the chat box for you to take a peek if you'd like to, but we have 5 regions in the red or control state right now, another 8 that are in orange or protect, and 7 in yellow. Since, it's interesting today when I was preparing, looking at numbers, I actually pulled up the numbers from January 15th till now. And in Ontario, we've had over 98,000 cases. Almost 82,000 of those have resolved, 3,415 deaths, which is a scary number. And our cases went up yesterday to 1,417, which is high. Obviously that's higher than we have been over the last little while. And right now we have 535 people in the hospital. Of those, 127 in ICU and 78 are on a vent. So scary, right? Like I hadn't actually seen the numbers really like that. So it was scary to kind of see it all together. Right now, I would say that, we haven't heard any suggestion that PT clinics will be asked to close or limit caseloads. Hospitals are behind in surgeries at this point after the last lockdown. And it does appear that the government seems to realize that there was a negative impact during that closure when rehab wasn't available. So we are hopeful would be my word. We are hopeful that we will be able to continue to work and be perceived essential as things, as we have to tighten up what we're doing. So that's kind of the update from Ontario. I'll put that link in case anybody feels like checking it out.
Awesome. Thank you
There it
for that. And now we're going to La Belle Province. Simon Dalle Bedove, give us the update, my man. Tell us what's going on from our Quebec friends.
Thanks, Kevin. So code red everywhere almost. The general trend is really bad. We've had about 1,200 cases a day for too long now. About 25 deaths every day. And the estimates are showing that we're going in a really bad direction right now. As of the restrictions, all the bars, restaurants, gyms, theaters are all closed. We are still able to have our haircut, and the clinics are still open. For how long? The clinics, we are really hopeful they're going to stay open. This is what we have heard from the health minister. We've been in contact with them and since the beginning of the second wave, and we are still essential and they want to keep us open. There are no cases of COVID spread in the clinics, in any clinics, so we are pushing to stay open by proving that we are safe. Now the discussions in the province right now, they are concerning the Christmas holidays and the possible closure of the schools for a bit of 1 week prior of the holidays and 1 week after the holidays. We don't know, but this is the main topic right now. It's the Christmas holidays in the province.
Awesome. Thank you, Simon. And
Thank
we're going to talk to the Queen Bee, the president of the CPA Board of Directors, Vivi Reese. Vivi, tell us from the 50,000 feet up, what's going on in the nation? How can you and the CPA bulletproof the practices of all the physios that are working on patients right now?
Yeah. So from CPA's point of view, we're really doing a lot of forward thinking. We just released a report from a foresight working group looking at what are we anticipating going forward? How will physiotherapy practice look going into the future? And there are a lot of opportunities and risks that are being identified and considered. It's interesting from our office. I understand that they continue to get a lot of questions about COVID, but they are also now starting to get more questions that were related to issues pre-COVID. So I don't know if people have sort of gotten used to living with the pandemic and monitoring the implications of the pandemic on your businesses. And so they're starting to think about other things. It's hard to know. But certainly the number one focus is how do we keep the practices open? And we've been lobbying extensively to push the message federally, and we've been working with our branches who are doing the same, just to push the argument that access to physiotherapy is essential to maintain the health of Canadians, to help them recover from non-COVID injuries and disease, but also we treat COVID in the hospitals, and those patients, when they get back into the community, they need to continue treatment. And we're also really trying to embed in the thoughts of officials that physiotherapy is a high quality, medically trained profession, that we're not a fringe practice. We're not in the same class as naturopaths and kinesiologists, and well, there are a lot of what are often referred to as fringe or complementary practices. So we're really looking at trying to promote the status of physiotherapy as part of the medical professional alongside doctors, nurses, and so on. And there's a lot of things happening at CPA as well. So a lot of good stuff. And, the weekend we're having Emma Stokes from World Physiotherapy, who will be talking about COVID internationally. So if you haven't already registered for the virtual summit, well, hopefully you have. But I think that'll be a very interesting high level view again, is looking at the international implications.
Fantastic. All right, guys. I know all of you guys on the attendees, people in the chat, are eagerly anticipating second wave strategies, how to bulletproof their practices. I want to take a little step back, guys. I want to go back and get into the minds of this leadership group that's on these titans that are on this panel right now. And I want to dial back to March 2020. And I want to start with Christine. Christine, when you first, because BC was one of the first provinces to be affected with COVID, when you started, at the time in March, there wasn't a lot that was known about COVID. It was pretty scary back then. People were very fearful of coming into the clinics. Clinics were shutting down by themselves. And finally a health order came to shut down clinics. Tell us, for the BC Physio Association, what was your first step? What was to pivot the province back? What were your first steps in March?
Yeah. So certainly in early March, I think we were all in a little bit of shock. But one thing that, for those of you that read my e-blast, one of the things I said in my first e-blast, that this is not a sprint, but a marathon. And, I'm sure some of us feel right now we're in a bit of an ultra marathon. So, but one thing that we did was we did take that step back. We looked at history and we said, what happened in the last pandemic? So we looked at 1918 and some of the stats around that, looked at the waves, looked at, as you may recall, we have a librarian, so she did some research for us, and we really looked at the history, the studies, the evidence, and we did that research. And so if you look at that, you'll see that first wave was smaller, the second wave was much bigger, and then there was a third wave and then a fourth wave. So knowing historically what happened 100 years ago with that prepped us to realizing that we needed to be in this for the long haul. We needed to look at things with that lens. And so that's what we did. We had to pivot fairly quickly because we had our in-person forum and in-person AGM that quickly changed to all virtual. And so really trying to provide that education. The other piece that we've been working on slowly building was our virtual care toolkit, so providing physiotherapy virtually. And Jeremy McAllister is one of our contractors who's been working on that along with Allison Hoons and Terry, our librarian, and then some of our other staff. So we took that and we really ramped up that toolkit so people could use that very quickly for virtual care. We did not keep that behind the member side. We put that out onto the public side, so that was shared with whoever wanted to come and look at it, because that's only fair. When you're in these kinds of situations, that's only fair to share what you can share to help support everyone. We really wanted to be certain that we were a source of information. So multiple e-blasts going out and posting a section on our website that people could go to just find that information about what's the financial assistance I can get from federal government or provincial government. Where can I access PPE? What about a plexiglass shield? Where can you buy those? And so those are the things we had information going onto our website. So we're trying to be as informative as possible. We're also advocating very hard with, the provincial government, the Ministry of Health, to get physio clinics back open once they had been closed down. And so I think that really helped. Some of our public practice physios worked very hard. And so with some of our physios who were not working, then they moved over and did some work in hospitals. Our Ministry of Health was putting together a list. So they were putting that together with our college and trying to get a list of providers who could be ready to assist if need be. So there were a lot of moving parts that we really tried to pull together. So really doing everything we could to assist our members through that very difficult and constantly changing, evolving time.
Fantastic. Thanks, Christine. So Simon, I want to go to you. And I really want to spend a lot of time on the current second wave, but if you can give me one highlight of what was your first step when cases were breaking out in March, there was a threat of the lockdown. What was just the one thing outside of what Christine had said that was your first priority?
To keep the private clinic open?
Correct.
I mean, in Quebec, the particularity is that we have a provincial private clinic federation. Okay, so the first step was to communicate with the federation and the physiotherapy college, and to establish a plan. And we collaborated, all three of us, to basically to inform all the members in Quebec, because it was going really fast. So informing people, that was the first step for the AQP. Yeah, that's it.
Yeah, fantastic. You know what, Simon, I think you hit the nail on the head there, that one of the biggest pivots from the pandemic thus far is this massive push towards collaboration. And we saw this across the nation where people were working in silos and pushing different agendas. And we had this pandemic where we're all equal and working together. I love that story in Quebec. When we move over to Ontario, PGM, tell us, what was one of the strategies outside of what Simon said, Christine said, that pivoted Ontario back onto the map and got people back into the doors?
Yeah, a lot of what was already said, we did as well, but, defining with CPA, we work with CPA in the college to define what's considered essential and emergency, securing virtual care funding in our funders here in Ontario so that we could offer that service safely to our patients. And the only other thing that I really had reflected on is, we were successful in terms of having physiotherapists doing a point of care risk assessment to determine what PPE was needed and not having that decided for them. So that was really it that was different. We did a lot of the same things.
For sure, absolutely, because we're going to be talking about second wave. I love that PGM talked about expanding the role of physiotherapy into the virtual care space, but also getting remunerated for that. A lot of people don't think about that, is that a lot of these insurers jumped on board right away from all of this back end work. So I really appreciate what the associations did to, as all of us were trying to pivot, you guys made it happen. You laid down the foundation for us to roll with. So thank you for bringing that up. Jim in Manitoba, tell us, give me the gem. I know you're that great storyteller. Give me the one gem, the one rock that moved Manitoba into the right direction.
When COVID hit in March, as they've mentioned, the early analysis, which we did with Shared Health, which is the provincial planning authority, and with the College of Physiotherapists of Manitoba, our provincial regulator, what we could see from Shared Health, and they were forthright with us, was that there was a shortage of PPE, and they did not have the protocol in place in relation to safe outpatient care. And so we were down to emergent and urgent care, largely within the public domain. And so we had to recognize that most of the clinics would temporarily discontinue service because they didn't have the equipment or the protocols in order to operate safely. That said, it was, what can we do while we're waiting? And the first thing was, of course, to look out for your staff and see what federal and provincial programs would be available, and to sort of button down the hatches and see how you could get through. And then as we did that and we fostered this collaboration, we began to see that the opportunity through April, and then we did it at the beginning of May, we would be able to reopen. And I must say that that opportunity of getting ready enabled a strong, sustained reopening in May, and we are determined not to look back from there.
That's amazing, Jim. So I'm going to pivot down to Vivi. Vivi, I'm going to go right into the second wave. I know you guys worked tirelessly through the summer to bulletproof. Now, guys, in the chat, everyone, who's ready to hear about the second wave plans that actually went in? Because it's in the chat. Tell us right now, are you ready to hear about these plans? And do you know, say in the chat, know that you know what your province's exact second wave plans were? Say yeah, say no. And KNOW. Come on, guys. Does everyone know what your second wave plans are? Put it in the chat. Okay, so we have a no as in no, but I mean no as in knowledge. Okay, must have been autocorrect, APGM. All right, so Vivi, let's take it right from the top. Tell us how the CPA has bulletproofed our second wave strategy, because we're gonna pivot right after that, after we talk to the panel about what we're doing right now. So guys, hang in there. This is where the meat is coming into this presentation. Vivi, the queen bee, is on the throne. Let us know, what are the second wave strategies that you have implemented over the summer?
First, I also want to talk about what we did initially. One of the surprising things we found is there was some confusion about when it first hit. So when governments were putting in sort of closure measures or risk reduction measures, and for example, in Ontario, in home care, we were told that we had to restrict care to only urgent cases. Well, a lot of physios just assumed that meant we had to close everything. And a lot of members called CPA and said, you need to tell us to close. You need to tell us to close. This is what we're hearing, and we need to hear from the National Association that we need to close. So what that taught us in the early days is that we have to really establish good lines of communication. And of course, everything we do is done with the branches because there's variation between provinces. But I think it's so important to consider carefully how we can get the message out to people in a way that everybody gets, because you know, when you start to hear these public health authorities talk about what you need to do in your business, I think it's quite frustrating and challenging. So I found that really interesting, is the sort of confusion that came through to the questions we dealt with. So with the second wave, I'd say right now our strategies from a national perspective, and again, the provinces, the regulators have a huge role to play. So just everything I say assumes that we will be working cooperatively with the provinces. But CPA wants to keep private practices open. We have been and are lobbying extensively to push the message that physiotherapists and access to physiotherapy is essential to maintain the health of Canadians, to help them recover from injuries, disease, all of those things that happened pre-COVID. And we need to get them out of hospitals. We don't want them occupying hospital beds. And that's a key role that we can play in the hospital setting. And again, as I said earlier, once they get into the community, they can't just sit in bed at home. They need access to ongoing care in the communities. So we're really pushing that that message that we will be risking reduced health for Canadians if public health authorities impede access to physiotherapy. So that's the number one message. We have a lot of initiatives to do that, and I know the provinces do as well. We are also putting out the message to health decision makers that physiotherapists are highly trained practitioners. We're not fringe or complementary practitioners. This is not something you do for purely for wellness. We're trained in the medical system. Evidence-based practice is a really key message. We get a lot of positive reinforcements when we talk about the fact that we're trained in using a scientific basis. We also try to make it very clear that physiotherapists understand infection prevention and control principles. We understand how to use PPE, the fact that we know how to treat infectious diseases in the hospital. So it's a natural progression that private PT practices are open to help once those patients come out of the hospital. And in the longer term, we're pushing for greater resources for community and home care. One of our initiatives is to use the long-term care crisis sort of as a frame of reference, and promoting that access to community physiotherapy throughout the lifespan of Canadians can improve independence, reduce or delay the need for admission to long-term care for the elderly population. And we're promoting the business case that this reduces costs and risks through maintenance of greater independence and health. So those are sort of the top three things we're focusing on in terms of our national lobbying and advocacy strategies.
Fantastic. Thank you. Simon, do you want to kick it off we're going to go from the East Coast. You want to tell me, now that you have collaboration, alignment that was achieved through the first wave, now tell me, what were the plans? Because Quebec has always seemed to have these numbers that were kind of high. I remember they creeped up over the summer quite quickly.
Mm-hmm.
I look at your province as such an interesting province where you guys are real trailblazers out there doing things a little bit differently. And being in Alberta, it's really cool to see that you guys are doing it without, regard of, who likes it or not. You guys believe in what you're doing. So tell me, a couple of strategies you guys had put in for the second wave, what you thought was what was mission critical.
Well, the continued collaboration we started in March. Well, it was a collaboration that we already have with the college and the federation, but I mean, we kept on having meetings, all three together, and to the plan. Well, each one of us had a mission. So the federation did a public campaign to inform about PT practice, so to the general public. It was during the time that in the news mainly that they were talking about what was the negative sides of cutting services, like increasing the waiting list for the orthopedic surgeries, and the lack of services, for example, physical therapy, to the general population. So they were like keeping the momentum to make sure that the public deciders were not closing the clinics again. So that was their mission. They worked as well on keeping the reimbursement for the telehealth. And the college worked a lot about PTs in Quebec. They can do the screening test for the COVID-19, and they worked a lot to make sure that even the final year students, either in the college program for technologists and for PTs in the university, so the final year students, they now can also administer the test. So this will help relieve all the PTs and technologists in the public sector so to keep and maintain the services to the general population. And for the private sector, we also at the AQP, we sent a letter to the health minister to make sure that we keep the clinics open. And one of the argument is that half of the PTs and technologists are working in the private sector, and they're ready to take more load to help the general population stay healthy. And we've received a really good answer that they have no plan of closing the clinics again. And we're, like I said, we are pushing to make sure all the PTs and technologists in Quebec stay safe and apply the directive from the health, I don't know how to say it.
Health authorities.
Yeah, exactly.
Yeah, no problem. Yeah, chief medical officers of your province. Awesome, Simon. So Paulette, I'm going to go over to Ontario, and I'm hoping that you're going to answer a couple of the questions in your strategic plan for state of the second wave of defining essential or redefining physio as essential. Was that part of your second wave planning?
I mean, I think we had already been doing that earlier on, but definitely right now we wrote a letter to the Premier and Chief Medical Officer of Health, urging them to have us stay open, to care for our communities. We're held to very high regulatory and public health standards. As somebody said in the chat, we have not been a source of community spread. Things have been going very well in the clinics. And on top of the letter, certainly we've had follow-up conversations with our contacts in the ministry, because you really have to take every opportunity to continue that conversation wherever it arises. So we've continued to do that. We also, from a public perspective, initiated a paid marketing campaign actually to help the public feel safe about seeing us in person, and that there's still the availability of virtual care. I'll put a link into a landing page that you guys can check out if you want. But so far it's live right now, it's still happening right now, this campaign, but we're getting good responses. People are spending more time on the website, they're engaging. So far it is looking like we're having a good impact there. And certainly in preparation for potential changes in how we're treating, we are circling back with all the payers that we had previously spoken to about virtual care to ensure that they're still going to continue to support that financially. And even in Ontario specifically, talking to FISRA, who they govern our MBA business, advocating for potential adjustment in licensing fees too, because there's certainly impact to our business. In private practice. So those are some examples of what we've been up to more lately.
Awesome. So I just want to touch base on that, because I think one of the key things that people forget about, obviously we talk about, case numbers, we talk about hospitalization rates, ICU rates, deaths. Unfortunately, these are real people, and I respect anyone who's lost a loved one. But when I say this is that there's a second victim in the private sector, and that's the therapist caseloads, where the public, because of this fear mongering that's happening in mainstream media, where they're bombarded with all sorts of negativity, that they're actually fearful to come in. And I'm wondering, Paulette, could you maybe describe, your marketing campaign for the other provinces? Was it about the safety of coming into the clinic? Can you elaborate a little bit more on that?
My understanding of it, I haven't certainly dove into a huge extent, but we spoke about it at a board level. It's really the theme behind it is we're here when you need us. Like physio is here when you need us. And then you get kind of past that level, and that's where the safety and all of that comes from. But one trying to put in front of, of course, they do all the magical marketing things where they can look at who, searches things rehab related, and they put it in front of them in their social media. I don't even know how all that happens, but it's magical. And I think this program is stalking me on Facebook because it keeps coming up in my feed. It knows what I do. Same as shoes come up when I'm shopping. So it's targeted, obviously, and the idea is to kind of put it in front of their face so that if they did have a need, then they would be thinking of us first as a solution, and feel confident in that decision to move forward. So that's my impression of it. There's probably more to it when you get into the technicality, and you know, we have professionals who are telling us how to do this properly.
Yeah, no, I mean, it's genius for all the attendees here on the chat. You know, physio pivots you through the pandemic, and you know, is an amazing marketing. So, Paulette, was that a digital campaign, or did
Yes.
you guys do that all digital?
Yeah.
That's awesome. That is an incredible knowledge sharing, and I think that's, you know, if there's, and one thing for private sector physios right now is to stay cool and cool and just like resilient, that we're gonna get through this, because people can tell, you know, your energy that you come in there with, that if you're stressed out, it's going to permeate through all your treatments. So I really appreciate the We Are PT movement in Ontario, talking about how we are truly behind you through the pandemic. Amazing. Any last thoughts on that, PGM?
No, that's awesome. We rolled it into the hashtag We Are PT movement as well, which I absolutely love. I still watch the video because it's so much fun, and I can't wait to get my hashtag We Are PT swag, but I haven't been able to go to the office. So
That's awesome.
One of these days I will be wearing a shirt.
I'm gonna fly over Manitoba for a reason, Jim. I'm not ignoring you. I'm gonna go over to the BC because there's a reason for that. So Christine, give us a couple of highlights of your second wave planning. Just some highlights of outside of what Simon has said, what PGM has said, and what you think Jim is gonna say. But give us some highlights of what BC did, because BC has been really proactive. Your government has been on the mic. Dr. Henry has been entertaining for her addresses to the media of what you should and shouldn't do. But what did PABC do for that second wave planning that is paying off right now?
Yes, Bonnie Henry is she's an icon, right? I mean, she's well known around the world, I think. And so we took that opportunity to regroup on our advocacy pieces. We'd been advocating, you know, for a number of years with provincial government on the fact that physio can help. And that's one of the reasons why we had the increase in students at UBC and in the North. So that fit right into that plan. We had a public outreach with ads on TV in the end of March and April, which was a bit of a fluke that we'd booked that timing in, but we pivoted those to be something different, and those went virtual care. But we'd already also booked in those same commercials, and we changed the commercial to happen in September and part of October. So that was a great public outreach that really pushed the message to the public that physio can help and that we're here through this time. We have a group within the Ministry of Health. It's the Allied Health Group. And so they're more my go-to group when I need to have a connect with government. And it's really nice that the government is positioning that group strongly within the Ministry of Health. And so right now it has similar footing to the doctors and the nurses. And so really showcasing the Allied Health Group. And that's really helpful when we need to talk to them about all sorts of pieces. And whether it's just pandemic related or if it's intern physios, whatever I need to call over about. We've been enhancing that virtual PT piece, so that whole telehealth toolkit, and we have a webinar series that's happening. So that's really good to keep updating and educating our members or non-members if they want to look at those. So that's really good and timely. The other thing that, you know, there was a bit of a lull in the summer, and, you know, as an association, we also have to run a business. And so it was really important that we take that time to make sure all those other things are happening, because we are going through changes with ICBC. We're negotiating a new contract with WorkSafe BC. You know, we are doing those things. So it was easier to take that time during the summer to write those letters to the Premier and really remind them how essential we all are.
Awesome. All right, Jim, the man on the mic. I'm really interested in your narrative because you're such a great storyteller. I want to see what that narrative was, what you guys planned for that second wave, and where it is now. Like, what are you guys doing right now to pivot from a province that is truly in crisis? If you hadn't heard us from the beginning, this province is looking at changing ice rinks into hospitals. Okay, their hospitals are full. So everyone on here, that you know, that the majority of people, please listen up on Jim. This is super important. What were the plans, and how? What are you guys pivoting to right this second?
Okay, number one, as we anticipated the second wave, we kept up our promotion and advocacy strategy that really is an ongoing effort to continue to share with the public what physio does and how beneficial it is. And so these are articles in the newspaper, the Winnipeg Free Press, and in digital and on social media. We kept that up to just keep it before the public. Then number two, good on CPA to have developed a template letter that really mirrored what they sent to the Prime Minister and the Federal Minister of Health and Chief Public Health Officer. We picked that right up, and in the second half of October, we got our letter out to our Minister of Health, the Deputy, and the Chief Public Health Officer. So it was a coordinated strategy. That said, we had the sense that there was continued an increased recognition that physiotherapy is an essential service. And with that sense of the confidence that the government has in us, and with the College of Physiotherapists of Manitoba really stressing the opportunity to live up to the expectation of being a self-regulated profession, we then partnered with the college, and with this latest Code Red, on November the 12th, it's right on the college website. Just like a good athlete, you just keep going with the fundamentals. Screening, specifically, how do you do that? PPE, no let up in the supply chain. 3 would be the physical distancing complementary to the PPE, and of course the sanitizing and the cleaning. You just keep doing that, and as we do that, we just have to carry on. So that's what we're doing, and I have one more comment toward the end with your last question, but that's the strategy that we employed.
So now, in terms of the next month or two, what is the strategy for Manitoba right now? Like, how do we?
Okay, here it is. Here it is. 1, it's to keep those fundamentals, no let up. And then number 2 is to be on the lookout for fatigue. It's to give yourself those pit stops. It's to stay focused. And so it's to recognize that we have to pace ourselves. As Christine had said, we're in for the long pull on this, not the sprint. And then the third thing is to look for opportunity to encourage, affirm, and support each other. Those 3 things are what we're going to be looking to do in the weeks ahead.
Fantastic. Thank you, Jim.
You're welcome.
Unreal narrative. Vivi, any thoughts on what was said and how the national agenda? Obviously, the CPA played an integral role. I've heard it from all the chairs that you know, the Queen Bee and the national office has definitely played this glue on this movement. So, any thoughts on what was just said? Oh, you got to unmute.
Sorry, this whole concept of working together has really happened, and I think it's fantastic. I think a couple of the really important things that I've heard is this idea of going to the public. I think the public needs to want our service, demand our service, they need to talk to their MPPs and MP and say physiotherapy needs to be available to us. So I think reaching out to your patients and make sure your patient understands when to contact you, under what circumstances to contact you, make sure they understand that you can see them through the pandemic, and that you're trained in PPE and infection prevention and management. It's interesting too, we did a market survey in the spring, and it was quite surprising because the public seems to have a great deal of trust in the physiotherapy profession, more so than other health professions that we often consider to be competitive with us. So they trust physiotherapists more so than kinesiologists or chiropractors or massage therapists or those sort of typical competitor groups. They also perceive us as being sort of medically competent. People talked about seeing us in the hospital setting as well as in the clinical setting, and that they know that we know what we're doing. So it kind of surprised me. And though the survey also suggested that the Canadians actually know what we do. They had a pretty good idea that we help with movement, with a variety of different conditions, exercise. So, whereas we have historically always talked about the public doesn't understand what we do, they don't know the difference between us and other professionals, they actually do. So I think we need to springboard with that knowledge, and through the pandemic, make sure they know that we're the ones you need to see. So if this problem comes up, we're here through the pandemic. And of course, the provincial branches and CPA are continuously promoting that message that physiotherapy needs to be deemed essential, and physiotherapists are capable of making the decision whether it's necessary and safe to see patients through that period.
So maybe just to recap what you said, and the reason why I'm curious about this is you talked about talking to your MPs, getting your patients to be a vocal advocates for yourself. I don't think in history of physiotherapy did I ever hear a prime minister use the word physiotherapist in a national address more than twice. I heard the Prime Minister Trudeau say, "We've heard from physiotherapists," and I posted on the Instagram channel about how physiotherapist was mentioned again when they were talking about the I believe it was the wage subsidy. Sorry, or was it maybe the CEBA? The CEBA
Yeah.
talking about, but he had mentioned specifically physiotherapists, not chiropractors, not kinesiologists, not acupuncturists. So I think that's huge. My question to you guys as a panel is would you encourage physiotherapists to go on national, on their local TV and advocate for physiotherapists? Because I did see that on the East Coast. I did see that in Calgary. I did see that in Toronto, and I did see that in Victoria. And how effective do you think that is in getting the word out that PT is safe, effective, and that patients should come in? I'd love to hear from the panel. Go ahead, Paulette.
Sure, a few things. So quick before I jump to that one. I think the biggest impact we have is every day, every patient we see, making sure that we are meeting the standards as laid out by, infection prevention control, public health measures, right? Like that's our most important thing, is that we do that well, and that we do it obviously. We sanitize in front of patients so they see us doing it. That's marketing. It's showing that we know what we're doing and that we're safe. So number one. Then every time we communicate with an external funder, you're talking to an adjuster, talk about the protocols you have in place. So you're telling them that we've got this, we're doing it safely, so that people can get more confident that we offer a hybrid model of care. So we're ready for virtual in case we need to pivot, right? And then I do think looking for opportunities to speak to either MPPs or media, if you're so inclined, is a great thing. I would definitely recommend, and I certainly do this, anytime I have an opportunity like this, get in touch with, CPA or provincial branch to help prepare. Like it's always great to have kind of some bullets that you want to get across. And that's why we're all here to help with that, right? So I certainly, if you're so inclined, would encourage you to look for those opportunities, seek them out, and then ask for help getting ready, because there's lots of people who can help you through that.
Thank you, Paulette. Christine.
Yeah, so I agree. Great points, Paulette. And I think when we're looking at these opportunities to get in front of the camera, whether it's with your local television station or something more broadly, I think if it's a topic where you can sort of delve more deeply into it, I think that's always helpful, because that's the piece that really shows the depth and breadth of what physiotherapists do. And so there is huge respect for physiotherapists across the provinces and across Canada, but sometimes they don't know all of the things that physiotherapists can do to assist them. So when they're talking about something like pelvic health, or when they're talking about ergonomics, or they really get into depth in some of these conversations. I think that those are helpful. And so I think when we look at the future, I think we should probably spend some time and really go in, okay, how is physiotherapy helping those who have had COVID and, early on, and then what about those long-term effects? I think those are the things that we really need to start looking at, and potentially do some studies and have some webinars on those. I think that would be extremely helpful for not only for the physiotherapists and those in our community, but for the broader medical community and the public.
Awesome. That's awesome. Jim, Simon, any thoughts on that?
Well, following what Christine just mentioned, during the month of October, I think there was a lot of attention turned to the problematic of ergonomic with people working at home, and a couple of physical therapists in the province went into the media to mention how they could save their neck, save their back, and how they could use physio to help them. So I think this is the best promotion we can do, and we certainly would like more people doing that.
Absolutely. Yeah, definitely. Jim. All right, Jim, I'm going to just unmute you for a sec.
Here we are.
There you go.
It took us several months, like a year. We did a redevelopment of our website, and in particular, the Find a Physiotherapist and the search function, to make it as user-friendly and nimble and responsive as possible. We are just about ready to go live with that, and we're going to integrate that into our ongoing promotion and advocacy of physiotherapy. And we figure the best, like as Vivi was saying, it's for the public to know how to access outpatient physiotherapy. And we believe it's incumbent on the branches to have really good Find a Physiotherapy capability in our websites, and to keep promoting that through whatever we do. And so we're going to get out of the gate on that as we finish up the year. And we think that that's really important on an ongoing basis, as you match that up with increasing the level of understanding of what physiotherapy does. So we will be ready to share that through CPA in terms of just looking to make it available. You already have, other branches have them, and it's to always keep learning from each other.
Thanks, Jim. I got a question for the panel. In all of the waves that we've had, the first wave and the second wave right now, we've had government officials outlining restrictions based on their chief medical officer, who happens to be a doctor. Currently, there's a tremendous wave across Canada where medical doctors themselves are advocating for surge lockdown. So that is 2 to 4 weeks where all businesses are closed. And my question to the panel here is, we talked about collaboration. We talked about leveraging across healthcare associations and bridging that. Now we have a healthcare association that's advocating for a surge lockdown. What is the strategy from the panel here to almost combat our referral source and probably the source that tells the chief medical officer, who then tells the prime minister or the premier? Like, what is our strategy here? Because I know there's a lot of people there where their hearts are beating pretty hard when they hear the word, surge lockdown. I'd love to hear your thoughts.
It's to have no community spread through physiotherapy clinics. Stick with the fundamentals, because if there's no evidence of it, then that turns it back towards saying then we don't need to be locked out or locked down on this. And so I think that's my first response. Thank you.
Jim, that's a mic drop moment. Wow. Oh my God, that was amazing. All right. Vivi, what would you say? Right? Prime Minister Trudeau is sitting right in front of you. You are the queen bee, the president of the CPA. And he says to you, the doctors are saying, close it down. And you say,
well, I honestly, I can't imagine a situation where the doctors are going to say, close down the physiotherapy clinics. And I had a conversation with the federal minister of health, and she essentially said the same thing. CPA, we work in partnership with a variety of other regulated health professions, and we've been meeting with them all along and lobbying the government all along. So I would certainly, from a federal perspective, there seems to be an understanding that you can't just lock down every healthcare business and think that everything's going to be fine in the healthcare system. But I think from a provincial perspective, I don't know how much control we have over positions there. I can't help but agree with Jim. As long as we keep infections out of outpatient clinics, that's going to be a huge selling feature.
I'm wondering if that would be collectively as the associations, if that would be a big push in terms of our essential and safe care, that there's been no spread across or transmissions across or known spread across physiotherapy private practice as a marketing initiative to say this is super safe, that patients should be coming in because it keeps them out of the hospitals. Guys, I want to open it up in the chat for all the attendees. This is the moment where I'd like to turn the mic over to some of the attendees to ask our panelists some provincial specific questions or some national questions for our president. So feel free, if you want to jump onto the mic and ask your question, please feel free to just raise your hand. Or I can just read the question right now. The first question we've got here, Tori, I'm assuming that is John Tori, leave the house for groceries, work, medical appointments. I assume we would be under the umbrella of medical appointments. PGM, your thoughts on John Tori's comments?
I would 100% assume we're under medical appointments. Yeah. So we just have to make sure that's how we position ourselves, right? Like, you know, in any opportunity to talk to patients or anybody else, that it is medically necessary treatment, right? Not just wellness. This is not going to a spa and getting, you know, some treatment. It's medically necessary, helping our patients stay functional and healthy at home safely. Yeah.
And that's that whole perspective of, we're a medical professional. We train in medical schools. We train alongside the doctors and nurses. We're pushing that message as well. So I think that's an entirely reasonable approach to take. Yeah.
Awesome. That's great. So I want to ask the panel, while we're waiting for any last questions, if there's one thing that you can leave with our audience today, the one thing they can do to bulletproof their practice through the second, third, fourth wave to come. Tell us, Christine, what's the one thing they can do right now?
So certainly follow those practices that they have been doing, that have been outlined by the provincial health authority, so that they can remain open.
That's awesome. Thank you. Paulette.
Mm-hmm. Sure. I mean, rock solid infection prevention and control. We need to have that down like it is something we've always been doing. And in private practice, I think, you know, quite frankly, I think we were great at being clean. I'm not sure we were great at disinfecting, like the next step, you know. So I think we need to make sure we've got that down to a science. It is something we do every day without even thinking, but we do it well. I think we just have to do that. And I do think we need to be smart about a hybrid model of care and be prepared to do virtual when it's warranted, necessary, good for the patient, all that kind of stuff. Those would be the two things I would say.
Fantastic. Simon, from La Belle Provence, what inspiration can you give our audience right now to take them through the next 6 months?
it's just practice safely and follow the measures. So that's it. That's the most important point. And I just got. Have you seen the question about the what about our role in all the surgical backlog, Karim?
Yep.
And this is something we mentioned to the health minister, that it would be really a big negative effect that people on the waiting list that is increasing cannot even have access to physical therapy care, which are able to keep them active, functional, waiting for the surgery. So this is actually an argument that we sent to the health minister.
That's awesome. That is absolutely imperative that the health, the overall quality of life and healthcare of people are being compromised by not being able to get to therapy for prehab and rehab for surgical cases. Paulette, could you just comment, because I know you have a lot of like sort of insight on the medical mask and the cloth masks. Do you think you could answer Kathy's question that whether we should be giving medical masks or cloth masks and that whole paradigm?
As I haven't seen Kathy's question. Oh, I see it up there. To clients, I think I can tell you I mean, I work for PT Health and LifeMark, and certainly in our, since the beginning, we have been giving procedural surgical masks to our patients. So we wear them, we give it to them, and it has helped, I think, to just kind of increase the level of infection prevention and control that we're doing. According to public health standards, that's not necessary, but it is certainly a choice that we made. There's expense with that, obviously. A mask for every patient, there's expense, but it has helped to our staff feel just that little bit more safe. And there are still some patients who are annoyed when we ask them to change their cloth mask into ours. We try to educate them on the difference and why it's necessary. And there are some patients where we've had to say, we'd be happy to see you virtually, if they're not willing to switch to the surgical mask that we require. So it's hard. That's a decision that needs to be made at a clinic level, whether that's something that you can do. I can tell you that we have done that, and I do think it has been a good move.
Absolutely. Definitely the science does back two people wearing medical masks. And I don't want to address the elephant in the room about physical distancing and why certain industries are able to sit 1 centimeter from each other, but physiotherapists need to be 6 feet apart. I'm not going to address that. That's a whole different ball game. But that's probably something that could be our strategy in the future if somehow we're locked out for some reason in terms of providing safe and essential care. Jim, tell us what's one inspiring thought that you can leave our audience with.
I have nothing really further to add. Those comments that preceded me were excellent. But Karim, you need to know, thank you for your organized enthusiasm and encouragement and good questions. I think this has been a good hour. Thank you.
No, I appreciate that, Jim. And I really appreciate, and Vivi, you're going to have the last word here. Tell us, leave us with the most inspiring comment possible.
I think that, and I'm going to spin off what one of the other panelists said earlier. I think going to the public, I think the public needs to be, we need to be in their face. We need to be good at what we do. You need to treat them, measure outcomes, tell them that they're doing well, do well, and let them see you practice hygiene. It's a word we don't use too often, but let them see you sterilize the table, let them see you wipe down surfaces, let them, I love the idea that, of giving a surgical mask to a patient, because it shows that you're going the extra mile. I think if we do well and we show them that we're professional and build confidence in physiotherapy as a healthcare profession that they don't have to worry about, they can go and get their treatment and relax. I think that's a really important piece. Just be in your patient's face. They're your number one conduit for public opinion. So that's my last word.
Amazing. Thank you. I just want to thank everyone, this entire panel. Everyone is going through a significant amount of stress in their provinces nationally and have taken great lengths to attend this seminar. So I want to, in the chat, guys, let's give it a high five for our panelists for showing up, being prepared, going all out, spending the hours to bulletproof our practices, to provide care for our patients, to allow us to put food on the table for our own family. I am so excited for this profession, for the next 6 months, for the next 25 years, this era of collaboration. So COVID may have been a negative event, but has created the seed for opportunity for us to come together and to build a bigger and better profession that connects and is able to become resilient in any pandemic. So thank you, everyone. Thank you for the panelists for coming to it with all of their insights. I look forward to the constant collaboration, and I thank each one of these leaders for being part of a historical session, the first of hopefully many of open conversation, open dialogue, experience sharing, and taking our profession to the next 100 years of succession. So thank you, everyone. I really appreciate you guys coming out here. And in the chat, guys, put down what you rate the session at out of 10. If it's a 10 out of 10, 20 out of 10, we got it. We got all sorts of 12s and 10s. Thank you very much, Christine, PGM, Jim, Simon from the Belle Provence, and the Queen Bee from the Nation, Physio Kareem from the Proper Practice Division. I'm so humbled and grateful for you attending. Have a great night, guys.
Thank you, everybody.
Well
Stay
done.
safe.
Thank
Take care,
you.
guys.
Stay safe, everyone.
Everyone.